I want to begin by thanking our colleagues and witnesses for joining us on this morning. It's like a day after morning after some big elections around the country. We'll see after the smoke settles what it looks like. Well, one of the great things about being on this committee is we actually kind of like each other. And the Democrats and Republicans, we like to work together. And we believe that bipartisan solutions are lasting solutions. And when the elections are over, and let's figure out how to work together and get things done. But I'm particularly pleased today that we're going to hear from three witnesses who are uniquely qualified to share your perspectives on the challenges. And I think when I think of challenges, I think of opportunities. Challenges, I think, of opportunities are very much the same. The challenges faced and the opportunities presented by clean water systems serving small, rural, and disadvantaged communities in Delaware and West Virginia and across our country. As many of you know, this issue is personal to me. My family, Shelley's heard more times than she wants to remember. She's lived her whole life in West Virginia. My family, my sister and I started there in Raleigh County near Beckley. And we lived right by Beaver Creek, which you couldn't swim in, you couldn't drink the water, couldn't eat the fish from Beaver Creek. And so we learned early on why that was a problem and why we needed to do something about it. But with that said, often when we talk about water infrastructure in our country, we tend to discuss drinking water systems that bring water to our homes, to our schools, and to our businesses. Yet it's important to note that wastewater and stormwater systems are every bit as vital to the health and to the well-being of our communities as their drinking water counterparts are. And I want to be clear, clean water systems are indispensable. They mitigate pollution, they protect the health of our waterways, they shield communities from storm water runoff, and they even help to halt the spread of disease across the country. For example, health officials in our state, Delaware, have been able to use data from our wastewater facility in Newcastle County, where about 2/3 of our population lives. But in order to track the spread of opioids and diseases like COVID-19, they've been able to do so thanks in part to funding and resources from EPA. These types of public health advances are what we should hope every community in America has the opportunity to embrace. For over 35 years, Congress has provided federal wastewater assistance to communities through EPA's Clean Water State Revolving Fund program. And in the last 10 years, we've heard from many disadvantaged communities that struggle to compete for these funds. In addition, aging facilities, rising costs, emerging contaminants, climate change, and population shifts have all contributed to mounting financial burdens for wastewater treatment facilities throughout our nation. These challenges are even worse for small, rural, and disadvantaged communities, which oftentimes have fewer ratepayers, and as a result, typically have fewer resources. Many of these same communities also struggle to effectively administer clean water systems due to a shortage of qualified labor and technical expertise to address growing challenges. Last Congress, our committee came together and worked to address many of these challenges in the Drinking Water and Wastewater Infrastructure Act. Some of you may recall we drafted, we negotiated, and we unanimously advanced this bipartisan legislation out of our committee and went on to pass the full Senate by a vote of 89-2. Senator Capito will tell you that doesn't happen every day. An 89-2 vote. It was a date I'll never forget. But our water bill, that bill, combined with our committee's historic highway legislation, served as the foundation of the bipartisan infrastructure law the President signed into law almost 2 years ago to the day. The bipartisan infrastructure law, we provided an unprecedented $55 billion with a B. $55 billion to improve our nation's water infrastructure, largest investment that we've ever made of its kind. And as part of that investment, we included more than $11 billion for clean water infrastructure needs. And I might add, and this makes me especially happy as an old recovering treasurer, it was all paid for. Bipartisan infrastructure law also directed EPA to provide nearly half of this funding in the form of grants or principal forgiveness. We did so to help address the backlog of wastewater infrastructure projects and to support more rural, low-income, and disadvantaged communities. The wastewater investments made through the bipartisan infrastructure law were historic. They were much needed. Yet, as I said in our September hearing on the law's drinking water investments and authorizations, there's more that needs to be done and more that can be done. And I often say that everything I do, I know I can do better. There's always room for improvement. I think that's true probably for all of us, and it's true here today. As we all know, water is essential for life, and clean water is essential to our health and well-being. We close by offering some beautiful words of wisdom from the late Dr. Martin Luther King. And I think these are good words for us today. These are good words for us any day of the week. Here's what he said many, many years ago. No matter who we are or where we come from, we're all entitled to the basic human rights of clean air to breathe, clean water to drink, and healthy land to call home. Now, I agree with him. We have a moral obligation to provide Americans with clean water access and these other things as well. Today's hearing is an opportunity for us to think about how we can better support wastewater services in small, rural, underserved, and disadvantaged communities. And again, we look forward to hearing from our witnesses to gain your insights on our work and to hear your new ideas as well.